Hi, I'm Associate Professor Case Neidham, and I'm the Clinical Director of the Addiction Medicine Service for the Wide Bay Hospital and Health Service. One of the things that I love about addiction medicine in the public sector is that you get to do so many different things. In the first instance, I get to work with a team. So unlike many other areas of medical practice, which are a bit like speed dating on a one-to-one basis, I get to work with a fantastic team who are my eyes and my ears. One of the other things that I love about addiction medicine is not only do I get involved with actual individual patients at a very, very personal level, but I also have a role in educating my peers. I also have a role in contributing to advocacy for policy change. I get the advantage of being involved with real individuals who really tell me their own personal narratives, and over time I get to see how those narratives change. And for me that's so much more rewarding. I was inspired to train in addiction medicine because after 10 years working in emergency medicine, I probably burnt out and was looking for a next subsequent challenge. I was always interested why so many people presented to the emergency medicine with some form of existential grief that had caused them to abuse one or another substance. And it became a bit of a curiosity point for me. What I wanted to know is what causes someone to end up sabotaging their life, I guess, through the use or the abuse of one substance or another. So I guess I was in the right place at the right time, and my curiosity just took off. There wasn't a lot known, and for me, entering the area of addiction medicine is a little bit like becoming an astronaut, in that it's uncharted territory. At that time, CTs and MRIs were only starting to deliver a new view or a new model of neuroscience, and what underpinned the neuroscience model of addiction. So I came into it at the right time. I think it's important for anyone who goes into addiction medicine to realise that you aren't on your own going to cure anybody, but what you are going to be is an aid or a traffic light to help people to cure themselves. And that's a very, very interesting, multifaceted journey. So you're a little bit like a coach or a mentor, or someone else who shares a part of another individual's journey. And for me, that's very, very fulfilling for my soul. The tip that I would suggest anyone interested in going down a career path of addiction medicine is to do so as a second career. The reason I say this is that because that's how I entered into it. My initial career was through a fellowship of emergency medicine. Second point that I'd like to make is that I think the practice of addiction medicine can be a little bit intense, and it seems to me easier in terms of longevity to have it as a companion to another career. In my own case, the companion career that I have was in medical education or in medical administration. The process of gaining a training position in addiction medicine is evolving. If you recall, the specialty itself is only quite new, having initially been constituted in 2002. In Queensland at the moment, even though there are 22 fellows of the chapter of addiction medicine, there are only 13 full-time equivalents working in the public system. That said, the workforce calculations are that we probably need around 50. So the new positions will be evolving everywhere. And my suggestion for anyone interested is, in the first instance, to speak with someone such as myself and see what the opportunities are. The advantages of training regionally in addiction medicine is, particularly in the public system where most of the training occurs, is that a component of why people end up with substance use disorder has got to do with their position in the socio-economic status group. A lot of our patients are third generation unemployed. A lot of our patients come from disadvantaged, suboptimally educated. Now, as we all know, the social determinants of disease suggest that the further you go away from the large cities, the more you have these problems in terms of SES. So I think Our patients are much more interesting from that particular point of view. I wouldn't say they're much more deserving, because people with substance use disorder fall anywhere on a very, very wide continuum, or a very wide spectrum. But I think the other aspects to their lives, the parts that I like to think underneath the water level of the iceberg, are so much more apparent and so much more easy to deal with in a regional or in a rural setting. In order to obtain a fellowship in addiction medicine, you need to apply via the Royal Australasian College of Physicians, chapter of addiction medicine. The pathway to the fellowship is a minimum of 6 years training, with 2 separate pathways which are possible. The first pathway is to spend the first 3 years completing the basic physician training, and then continue with the advanced training of 3 years. The second pathway is to obtain a fellowship from another accredited college. That may be the the Australasian College of Emergency Medicine, which was in my case, or the College of Anaesthetists, or the College of GPs. If you have a specialist fellowship, that will then enable you to shortcut the initial 3 years of basic training. Either way, you will have to complete 3 years of advanced training. Those 3 years are made up of 18 months core and 18 months elective. The entry requirements or prerequisites are that you need to have general medical registration with the Medical Board of Australia, completion of a RACP basic training including written and clinical examination, or having a fellowship of another eligible medical specialist college, chapter or faculty, secured employment in an appropriate advanced training position. The application and selection process includes: to be selected onto the Advanced Training in Addiction Medicine program, applicants must first secure a position with an accredited training facility. In Queensland, there is no central allocations process for addiction medicine positions. Recruitment to training positions is managed directly by the training facility. New and current trainees need to apply for advanced training each year with the RACP. Once you have secured an advanced training position, you must prospectively apply for approval as part of the RACP progression through training policy. The key message that I'd want to convey to anyone interested in training in addiction medicine here in the Wide Bay is the fantastic team that I've been able to build. The practice of addiction medicine is very, very much a team sport. I have a group of clinical nurses who are my eyes and my ears, and as a trainee, they will be your eyes and your ears as well. So I think the practice of addiction medicine is a team sport, and the team that we have here in the Wide Bay is phenomenal. It's fantastic.